This is a project that's co-authored with Atonu from Taka University, Giovanni Reggiani from MIT, and Natalia Regal from Harvard. And I'll be talking to you today about hand washing with soap and using that as a context to explore habit formation and in particular to test the theory of rational addiction. Okay, so why do we care about hand washing with soap? We see incredibly high rates of child stunting and mortality worldwide due to bacterial and viral transmission. And this sort of transmission generally manifests itself in diarrheal disease and ARI, which is acute respiratory infection. So you can think of coughs and colds. And this in turn leads to 3.5 million child deaths yearly, according to UNICEF and WHO. So it's massive, it's tragic, and it's particularly tragic because we have the technology to address it. And the technology is cheap, and it's very easy to do, and that is hand washing with soap. So the World Bank has called hand washing with soap the most effective vaccine against childhood infections. Kramer and Zwaney, in the review paper on how to deal with diarrheal disease, cite it as potentially the most cost-effective method of reducing incidence. Yet, although it seems quite effective, hand washing rates are abysmally low worldwide, and this is particularly true for critical times. And by critical times, I mean after defecation, before food production, and before food consumption. And for the rest of the talk, I'll be focusing on before food consumption, because this is generally, in much of the world, people eat with their hands, and so this is kind of the last point of transmission of germs from the outside world into your body. So why is this the case? Why are rates so abysmally low? The first thing I want to kind of agree on is that it doesn't seem to be information and it doesn't seem to be resources. The hand washing hygiene, the hand hygiene public health literature is very rich, it's very long, and usually it's all about information campaigns and resource campaigns. You teach people why it's important to wash your hands with soap, you give them soap and you give them water. And to generalize, it seems that the treatment effects on these campaigns are largely zero. So 0 on sustained changes in behavior, 0 on child health impacts, unless the campaigns are incredibly, incredibly intensive in ways that are not scalable. And I'm going to show you some evidence that in our context in West Bengal, this is also true. People know it's important to wash, people have the resources, and they don't do it. What I do want to focus on is that hand washing is a repetitive activity. You have to do it daily, you have to do it at particular times each day. And so this repeated engagement is costly unless it becomes habitual. The second feature of hand washing is that it's a preventative activity. And by nature of being preventative, the returns are not manifested, right? They're kind of intangible. It's likely that people underestimate, that the perceived returns are underestimated. Likewise, preventative health activities have returns in the future, which can also, if people have high discount rates, mean that individuals are not truly internalizing the real returns. And this applies, so this kind of pattern of it not being information, not being resources, and it being a repetitive activity and being a preventative activity applies to many preventative health activities that we care about in the developing world. So water treatment, medicine regimens, latrine use, cook stove use, and of course you can expand this to non-developing countries, exercise, nutrition, diet. These are all habits. We know how to do them. We often have the equipment to do them, and yet we don't engage. Just to go back to the information and resources thing, this is our sample in West Bengal. We're working with about 3,000 households in rural West Bengal. You can see that people are very sophisticated about the knowledge on germs, on soap, on hands. And yet, oh, and also, so knowledge is checked off. Also, 100% of households eat with their hands. 99% report rinsing their hands with water before eating. This is a very common social norm. So if they have water, easily accessible. 100% have soap in the house. 90% report using it for bathing. So clearly it's not water, it's not soap. And yet 14% are self-reporting washing with soap before they eat. And I can guarantee that this is a huge overestimate. We did a pilot in the same villages 4 months before, And at that point, the self-reported estimate, which is always overestimated, was 8%. And so just over those 4 months, I think people heard we were going to expand, this is going to be a big project, and so then we get 14% when we come back. And that's important to note because this is generally the most common outcome measure that people use when they do these hand-washing campaigns. They're self-reports of what people, you know, their hand hygiene status. And if you ask them why they don't wash their hands with soap, 57% will say unprompted. They'll say in Bengali, they say abhash nai, which means very literally, I don't have a habit. And another 17% will say that they forget. So this suggests that it has something to do with the nature, the behavioral nature of the activity.
Just a quick question.
Yes.
If you wash their hand, just know the soap.
Exactly, yeah. So they rinse it. They have the water to rinse it. They just don't engage the soap, which they also have at home. Okay, so we're going to take this habit formation idea seriously and motivate it with Becker and Murphy's theory of rational addiction. But before I go into the rational addiction part, I want to lay two things straight. The first is that throughout the talk, if I say addiction and if I say habit formation, they're going to be interchangeable because the way we model it in econ models is identical. The mechanism is this. Something is habit forming if there are intertemporal complementarities in the utility from consuming that activity or that behavior. And what I mean by that is that the more I've consumed in the past, the more consumption stock I've accumulated, the more likely I am to engage in it today. That's all the intertemporal complementarities mean. So that's habit formation. That's just the nature of a behavior. Now, what is rational habit formation? Rational habit formation is I am rational about my habits if I'm aware of the intertemporal complementarities, which means that when I'm deciding to engage in a habitual activity today, I'm kind of plotting out the entire discounted future path of consumption because I know that these intertemporal complementarities, which in turn means that if I anticipate something changing about my consumption in the future, that's going to affect what I decide today about engaging. So the most intuitive way to think about this is with cigarettes, and this is what most of the literature looks at, cigarettes and alcohol, when they consider this idea of rational habit formation or rational addiction. So if I'm addicted to cigarettes, and next week I'll be in the boonies, and I won't have access to a store with cigarettes, and for some reason I can't fly with cigarettes, I know I won't have access to cigarettes next week. So what do I do this week? I might want to cut back on my consumption this week so I don't really suffer next week. So the literature on rational addiction is also quite rich, but this literature is all using non-experimental time series data. And it runs the following regression. It says my consumption today is affected by my consumption in the past. If that theta, that coefficient on C, consumption in the past, is positive and significant, that implies that this behavior is habit forming, right? The more I consume in the past, the more I consume today. It's also affected by my consumption in the future. If that coefficient, beta times theta, is positive and significant, then I'm a rational habit former. So the more I consume in the future, the more I will consume now. Or the less I'll consume now, depending on which direction you're expecting it. Okay, and then the P is just other demand shifters. Now the way the literature kind of tests this, of course, consumption in the past and consumption in the future, they're both endogenous. And so we usually instrument with prices or future tax rates, for example. So you think, okay, tax rates for cigarettes go up 1 year from now. How do I behave now? That's kind of the standard in the literature. And I'm sure you guys can see the difficulties with that approach. Some of the very large empirical concerns include endogeneity of the tax instrument. Maybe I live in a place where cigarettes or smoking is becoming more unpopular, and that's why tax rates are going to go up in the future, and that's also why I withdraw consumption now. Or there's serial correlation in prices, which is just true all the time, and this then leads to a lot of false positives about rational addiction. Or I think what is the most worrying is this implausibility of future price knowledge. These papers look at changes in tax rates a year from now and look at your behavior today. I mean, there's plenty of evidence that people aren't even salient about their tax rates today, let alone a year from now. So I argue that this is a great time to introduce a field experiment where we can kind of address each of these issues. So the contributions of this study, yes.
Before you go to your field experiment,
yes.
Can you go back to that, please?
Yes.
That's what I'm wondering.
So if you think of so I think in your example, hand washing, at the point at which it's OCD, it's a bad thing, the same way that cigarette addiction is bad. So yeah, so in that case, you've just drawn, I think, an appropriate parallel. I don't want to be OCD, so I'm going to try to bring back my hand washing. But I'm going to shift this to the good habits side. So this is another part of, the existing literature is all about bad habits, using alcohol use, using cigarettes. But this should apply just as equally to positive habits. The only difference is that in bad habits, I gain something today from engaging. I lose something from the consumption stock of engaging because of health internalities, right? I'm suffering there. And then also the consumption stock is developing a craving. Now when I shift to good habits, like hand washing, I lose something today because it's costly to engage. I gain something in the consumption stock from positive health internalities. And I also gain something from the consumption stock from the craving. Does that make sense? Did that? Okay. So thank you, because that goes to the second, or the second contribution. So the first is that, I hope that this can be kind of a first cleanly identified test of rational addiction. The second is that we're introducing this idea of good habits. I think this is very important because all these preventative health behaviors generally are habits. They're habitual, and we do want to understand how people engage with these habitual behaviors. I think it's important to test for good habits, and I hope this can get that started. The third thing is that we are going to be looking at distinguishing the role of rewards through incentives from feedback, which is often an implicit part of what rewards do or what incentives do. And you'll see this in more detail when I go through the experimental design. And the fourth thing, in order to do the first three things, we have to really improve the measurement technology that we use for hand washing. Like I said, the most popular measurement technology for hand washing is self-reports. The second most popular one is enumerator judgments, gradings. So they basically go to households and they say, let me see your hands, and then they grade it on a scale of 1 to 3 of cleanliness. And that's a standard. That's the basic standard. So you can see where bias, the noise, and just the scarcity of these measurements can play into not being able to have the power to test some important mechanisms. All right, and why do we care? Of course we care about the child health impact, but even beyond that, I think it's important to put this in the setting of habit formation, because if we want to design optimal interventions, we want to understand whether or not agents are rational about the habit-forming behaviors they engage in. Because if they're not, then we have an additional reason to subsidize their initial consumption of habitual activities. Okay? All right, so just a quick detour into the methodology. Like I said, the standards for measurement are pretty poor. And so what we did was we worked with the Media Lab at MIT to develop these time-stamped sensors that are embedded in these liquid hand soap dispensers, foaming hand soap dispensers. So we did a bunch of piloting to see what kind of soap, what kind of dispensers these households enjoy and will actually engage in. The reason we choose something that's like this, so I'm sure you guys have all seen this before, it's like the wall-mounted dispensers that you see in all the bathrooms. The reason we chose something that was wall-mounted is because we wanted to put it in a very particular place and attach it to a very particular behavior. When people look at, general hand washing studies use bar soap. Bar soap is used for bathing, it's used for laundry. It can be moved around, taken different places, and so you can't attach it to the particular behavior you're interested in, which is hand washing. So we use that dispenser, and then here you see this module. It's this plastic module. You can take it in and take it out very easily. Inside is a little circuit board and a lithium-ion battery and a coin cell battery, and it powers this little time-stamped sensor. So it records time to the second and frequency of use. Okay? And so here you see, we also put the dispenser in the veranda. So the veranda is where these households have their meals. We wanted to put the dispenser like right in front of their eyes, and anecdotally they say they liked that. They said in Bangla it's choke pore, which means it falls upon the eyes. So it reminds them to engage because it falls upon the eyes. So you see this little boy using it. Oh, one thing is we targeted households that have children ages 6 and below. So you see this boy using it, and then always in the courtyard of these households, there's either a pail of water or a well, and so you can just rinse your hands there. Okay, and to clarify, the outcome measure we're interested in is dispenser use during the family's self-reported evening mealtime. And the reason we focus on evening mealtime is, number one, because we want to identify a very, very specific habit. There's all of this psych literature about baby steps in behavioral change, right? We want to make it as easy as possible to change your behavior, make it very specific. The reason we choose evening mealtime is because this is when the household sits together and eats together, and this time is pretty stable throughout the year, which is not the case for breakfast and lunch. Okay? All right, so this is our experimental design. All I want you to get from this picture is that there's going to be a kind of an evolution of treatments over time. And we have our full sample, which is 104 villages. They're going to be randomized into what I call incentive villages and monitoring villages. And these guys are going to kind of run on parallel experiments. Okay? So first I'm going to talk to you about what we do in the incentive villages. So on the day that we roll out our dispensers and our soap, and all households get these calendars as a token of appreciation because the poor control guys get nothing else. So we have our incentive villages. We randomize at the household level between the control guys. They just get the calendar. And these treatment guys, IV1. IV1 gets the dispenser. They get soap. They're told the dispenser is theirs to keep forever. We're going to be replenishing soap for a year. And then they also are told that this dispenser can track your behavior. There's a switch on it. When we turn it on, it tracks your behavior. We know exactly when you're washing and how often you're washing. And for every day that you wash before your reported evening mealtime, you get 1 ticket. And these tickets can then be redeemed for a bunch of prizes, actually very similar to Anya's study. So it's like a catalog of prizes, which are small household goods and child goods. And these tickets can be accumulated and redeemed for that. Yep. So another reason we chose the evening mealtime is because we at least want to identify that if they use it, it's for hand washing and not bathing, laundry, or cleaning. Now the question is, when they press it, are they actually going to take the soap and wash their hands and go to the well? Now, we don't send people to watch them, so we can't verify it. Just from pilots in the field and talking to people, it seemed the largest cost of engaging in this activity was going to get the soap, going to get the water, and doing it. So our sense was that once you're there and you've pressed it, like it's coming out. So you might as well put it, it's already on your hands, you know, and they're already rinsing their hands with water. So if it's already on your hands, it didn't seem like a much bigger cost. And you know, hopefully when I show you the health results, it'll be compelling enough that they seem to have been washing. Okay, so this is what happens at rollout. So you get your control guys and you got your treatment guys. Okay? Now, after 2 weeks, we come back. Control guys stay the same. Treatment guys, we then randomize again into people who remain the same. They're getting 1 ticket per day. And these guys are told, hey, our partner organization, SHDS, has just received notification that they got a sum of money, or that they're anticipating getting a sum of money in a couple months. And they want to use this to really help you hand wash. And so what we're going to do is we're going to give you guys, instead of 1 ticket, we're going to give you 3 tickets per day, starting in 2 months when we get that money. So these guys are exactly the same. The only difference is that these ones are anticipating that in 2 months, I'm going to start getting 3 tickets per day instead of 1 ticket per day for hand washing. Is that clear? Yes?
Is there any risk that those 2 houses in those 2 groups could be neighbors?
Yeah. So these are all, they could be neighbors. It's very.
So ethically, how do you sort of, I mean,
yeah.
One house would say, hey, I'm getting 3 tickets now, so the house is getting 1 ticket.
Sure.
How do you deal with that?
So I skipped a step, but so here what we actually do is we say that you're going to be put into a lottery for this. And the reason we do that is not actually ethical. This is kind of a side benefit of it. The reason we do that is because we want to keep your expected valuation of the behavior of hand washing constant across these two groups. One worry is that if we tell these guys you're going to get 3 tickets in the future, and we don't tell those guys, these guys will think, oh, 3 tickets in the future, you guys must really value hand washing. I should update my prior on how valuable hand washing is, and then I'll change my behavior. I don't want that to change there, right? So if I tell, what we really do is we start here, we say, we're going to put you into a lottery. We're going to come back in 2 weeks and tell you whether you won that lottery. And that lottery will tell you whether you should anticipate three tickets. Okay? So in that sense, these guys know they're in a lottery. So they know that these guys have won purely by lottery. So even though they're neighbors, it's the lottery justification. Yeah?
How often are they actually getting tickets that are sort of salient and right in front of them?
Yeah, so I'm going to show you the graphs which will paint that picture nicely. The process for data collection is it's bi-weekly, so every 2 weeks. So a surveyor comes, they pick up the data from that module, they put in a fresh module. So when this first starts, say at rollout, right? At rollout, the tracking has begun, right? At the 2-week point is the first time we take the first set of modules out. And so these guys aren't getting tickets yet. Even though they know they've been accumulating tickets, they're not getting tickets yet. Only 2 weeks from then do we return, having processed that data we picked up two weeks ago, and then we give them tickets for these 2 weeks. So everything is kind of shifted, delayed 2 weeks. And you're going to see the response quite nicely in the graph, where people only react once they get the tickets in their hand. Yeah?
And was the ticket based on every single member of the family?
No, so we're just doing one. So as long as it's active once. We thought about doing multiple, saying like if we see 3 presses, but it's just so hard to game. I mean, so easy to game. So we just did 0 or 1. If it's active during the time of your reported evening mealtime, you get a ticket. Otherwise, you don't. Okay. So, sorry. So the reason I highlighted these two is this is where we get the rational addiction test, right? Everybody here has the same stream of incentives. These guys get 1 ticket, these guys get 1 ticket. The only difference here is that these guys are anticipating a boost in the value of the behavior in the future. Okay? So if we compare these 2 guys in this period, we should be able to find whether or not people are rationally addictive. So these guys will be getting 1 ticket. Before they get the 3 tickets, they're going to be getting a feedback of the 1 ticket. And we bring them. So when we bring them the tickets, we also mark on those calendars, look, you washed on this day, you didn't wash on this day, you washed on this day. And so they see 1 ticket for that day, 1 ticket for that day. So it's entirely ingrained in them that they're still getting just 1 ticket for these days. And you can bring this up maybe again when I show you the rational addiction results, but it seems it wouldn't make sense that they were confused that they started getting 3 tickets at that time, because they have feedback about the 1 ticket before the 3 ticket point comes in. Okay, I'm going to kind of run through this. So that was the rational addiction effect. Now what's this? Right here, after 2 months comes in, we do the following. Among the guys who are not anticipating anything, some guys stay that way. They're still getting 1 ticket per day. And some guys are surprised with 3 tickets per day, starting on that day. There's no anticipation here. They just start getting 3 tickets that day. And of course, these guys, 2 months comes around and they get what they anticipated, which is 3 tickets per day. So why do we do this? We do this because we have to establish that the 3 tickets has a pure incentive effect. Because if adding 3 tickets to your hand washing revenue doesn't change the value of hand washing, then of course I shouldn't expect people to be rational about some future change, right? So this is to establish the pure incentive effect of tripling tickets. And then this one will tell you what so this one, notice here, these guys have the exact same stream of tickets, right? They got 1 ticket here, they got 3 tickets here. So the only difference here is that these guys were anticipating it earlier, these guys were not. And so that shows you what the persistence of a rational addiction effect might be. So that was the incentives experiment, right? Now there are 2 problems with the incentive experiment. The first one is that incentives our pairing of incentives plus the fact that we're monitoring them, right? Like I told you, we're going to be giving them those tickets and we're marking on the calendar. And just by the nature of giving them tickets, they know, oh, I washed 6 out of the 7 days or 3 out of the 7 days. And so we want to disentangle the effect of incentives from the effect of just the feedback, just the information, or just the knowledge that people are watching you, okay? And the second thing is that rational habit formation would predict that if the value of my hand washing increases in the future, if I'm rational about it, I should start increasing my hand washing today, right? But the incentives, for 2 reasons. One is this idea that Anya brought up as well, this extrinsic rewards problem, also known as the hidden cost of incentives, that you might update how difficult a behavior is based on how much somebody is paying you for it. If you do that, then I might actually decrease my behavior today. And so those 2 things would counteract, right? They would dilute. So the hidden cost of incentives would pull back my behavior today while the rational habit formation pulls it up. And so we just want to try to disentangle these by offering an intervention that doesn't have this extrinsic aspect to it. And so we do a monitoring intervention. So that is this second part that's run in parallel. And I'm going to go through this quickly because it's quite similar. Here we have our monitoring villages, and you have your control guys, they just get their calendar. And you have your treatment guys, they get a dispenser with soap. Guys who get their dispenser with soap, in 2 weeks, we come back and we tell them they've won that lottery. So we do the same thing here. So we announce, hey, there's going to be a lottery, you're going to be entered in it. If you win, then you're going to get to look forward to a monitoring service. So when we come back in 2 weeks, we say, hey, you won the lottery, you get to look forward to a monitoring service in 2 months. These guys stay the same. They don't get a monitoring service. And the monitoring service is as follows. It's exactly the incentives minus the incentives. So the monitoring service is we turn on the switch, we're watching you, we're recording your behavior, and we're going to come back and mark your calendar. So it's everything the incentives is without the tickets. So here you see, again, this is a test of rational habit formation on the monitoring dimension. Okay? And then again, come 2 months, the guys who were not anticipating, some of them remain not anticipating and not monitored. Some of them are surprised with the monitoring, so we say, okay, you know, we had some extra resources, we're going to turn on your switch too if you want, and we'll monitor you. And these guys were anticipating the monitoring, and they get the monitoring. Okay? Yeah. So one thing we do is, in the control place, in the control guys, we also say, you should focus on evening, mealtime washing. So we say all of those things as well. Okay. But I agree that in the monitoring, it's kind of this, it's like a Fitbit, right? So it's like tracking, so I get the information about the tracking, but I also feel other people watching me, so it's kind of a mix of monitoring things. Okay, so here we get the pure effect, right, of just getting the monitoring service with no anticipation, and here we get the persistence effect of a potential rational addiction. Okay, cool. So the first thing I want to show you is that incentives seem to work the way we want them to work. What I mean by that is here you see these are guys, the red guys are the ones who just get 1 ticket, standard 1 ticket every day. Blue guys are dispenser control, meaning they don't get tickets, they don't get monitored. You see that in terms of lunchtime, or basically the full daytime, there's really no difference. They're exactly the same throughout, okay? Which is good, because what we did was not incentivize daytime, we incentivized evening. And so you see that for evening hand washing, the guys who are getting incentivized for it react to it. And in answer to your question, this is a better one. So previously I was just graphing the number of times you press the dispenser, but our preferred outcome is just that binary one about whether or not you press the dispenser at mealtime. And so here you really see this kind of start pattern, and that start pattern starts 30 days after the, right? Because here we start, here we pick up this information, and here we return that information. That's the first time they get the tickets, and they immediately shoot up. So they respond to the incentives as soon as it's in their hands. And those are 1-ticket incentives. And the other interesting thing I just want to point out is that you see these, so I plotted these as our survey visit dates. And so you see this shoot up, and then the decay, and then the shooting up again, and the decay. And the decay decays over time, which is one measure of habit formation, right? That Dubinsky has a model where he suggests that reminders and habit formation are substitutes. That over time, if I formed a habit, I don't need reminders anymore, which seems to be the case, right? Like at this point, it doesn't really have an effect anymore, me visiting you. Okay, so those are just on the extensive margin. Now, the results on rational addiction. So before we go into the rational addiction test, we have to establish two things. The first thing is that those contemporaneous incentives and monitoring actually had an effect, right? That when I actually give you these things, you change your behavior. The value of the hand washing changes. Like training a puppy? It's Pavlovian, right? I mean, that's part of it. But this part is not. This part is not habit formation. This is just the value of incentives or the value of monitoring, okay? And the second thing we have to show is that it is Pavlovian, that this is a habit-forming activity, right? Because if it's not habit-forming, I'm not going to be a rational habit former. So these two things we have to establish before we can do rational habit formation. Okay? So here I show you the effect of tripling incentives and the effect of monitoring. So these are the contemporaneous effects. And you see they're significant and I think also quite substantial. So it's about an 8 to 9% increase in hand washing rates for tripling incentives and about a 20% increase in hand washing rates if you start getting monitored. Okay, so that's a check there. And there you can see the graphs for that. So the red guys are triple incentives, the blue guys are standard, and then the red guys are monitored, the blue guys are standard, or dispenser control, okay? All right, and it also seems that that hand washing is habitual. So once we withdraw the incentives, so I forgot to mention that we give 4 months of incentives and we give 4 months of monitoring, and then we withdraw these. In practice, what withdrawing monitoring means is we tell these households, we've switched off your switch, right? We're not watching you anymore, and then we don't give them these feedback reports. And so you find that at least, so this is just, this is 4 months data for incentive guys and 1 month for monitoring. We're still collecting monitoring data. But at least for this time, it seems to be persistent, right? Even after I withdraw the interventions, if I was formerly monitored, I am still more likely to wash now, okay? Okay, and that's just the graphs of persistence. So you see decay, but it's still persisting. All right. And so here's rational habit formation. So first let's look at incentives, triple incentives. There seems to be no action on it. It doesn't seem that the people who are anticipating a tripling of tickets behave any differently from those anticipating, not anticipating it. However, there seems to be a lot of action on monitoring. So people anticipating being monitored in 2 months seem to react quite a lot to it relative to those who are not anticipating. So you see that here, this is for incentives. Oh, that's supposed to be gray. So this is the area in which they were just anticipating. Everything's the same here, except the green guys were anticipating and the red guys were not. And you can see it basically tracks identically. There's really no rational habit formation here. However, with the monitoring guys, again in this place, the green guys were anticipating, the red guys were not, and you can see that the green guys are really washing considerably more. It's actually 40% more than the red guys, okay? And the other interesting thing here is that, consistent with the theory, the more consumption stuff I've built up in the past, the more likely I am to engage in the future. And you see that as the green guys maintain their win over the formerly unanticipated guys, right? At this point, everybody's being monitored, and the green guys are still washing more, okay? All right, so I am almost out of time. I wanted to kind of discuss the reasons why we might see this difference between the incentives and the monitoring in terms of the existence of rational habit formation. I think part of it has to do with the nature of monitoring. It's something where you're anticipating a future loss, which might be much more salient, and you might be much more in the limited attention framework, you might actually be thinking about engaging in the future. Whereas with the tripling of tickets, you know, NBD, you just don't think about it, and so you're not becoming rational about it. It could also be this idea of hidden costs of incentives or anchoring effects, where I'm just less likely to wash because I've updated my sense of costs on a behavior when I'm incentivized to do it. But since I'm running out of time, I did want to instead also just show you some child health results. So here I'm going to just show you, this is a pooled sample. So treated households means incentive guys, monitoring guys, and dispenser guys. And the reason I'm showing you this is because you actually, we don't see any differences across those treatment groups. So it seems that really just the act of getting this dispenser with soap is making a big difference. And I'm going to argue that that's not a resource thing. That has to do with where we placed it, what it was, something behavioral about engaging in that with that activity. So you find quite significant effects. These are ITT estimates. So intention to treat estimates, you find 30% reduction in reporting any loose stool in the last 2 weeks. You have 0.08 fewer days of loose stool in the last 2 weeks out of a base of 0.2. Similarly for ARI, so significant reductions in colds as well.
How soon were the health effects apparent, and then did you report back the health effects to the household?
So we have not reported back the health effects. We actually just collected these. This is from data that was 8 months after the beginning of the intervention. And you might worry that this is, there's desirability bias because these are self-reported. But the nice thing is that we see that this translated into height for age and weight for age and mid-arm circumference for age Z-scores. And these are all adjusted for multiple hypothesis testing and still remain significant, which is nice. And these are, again, ITT estimates. If I show you the treatment on the treated, it's quite significant. So if you think of treated guys as people who get dispensers and use them, which is kind of a funny way to think about the act of hand washing, but this is kind of a lower bound on being treated as an engaging in the act of hand washing. You find an 80% reduction in total days of loose stool, a 35% reduction in ARI, 20% increase in height for age. So these are quite large, I think quite significant. And frankly, I was not expecting any of this. I think it's very, very hard to collect precise child health data, and within 8 months, we weren't expecting to see these results. So I think they're very encouraging.
What is the age group?
So the loose stool and ARI, it's ages 13 and below, and then the weight for age, height for age, and mid-arm, that's 6 and below. Yeah, it's a tricky thing to interpret. So the TOT is assuming that the control guys, they don't have dispensers, right? So they're at 0. But in actuality, maybe they wash 1 day a week, right? So then you'd have to multiply proportionally.
If it's 80% reduction, there's not much more.
Yeah, you can't go much further. It
seems like it'd be useful to benchmark those against some existing studies about just back in the envelope, we see this much more hand washing. Is it all?
Yeah, so there are very few studies that find child health impacts. There's one big one, which is Stephen Luby in Pakistan, and their ITT estimates for a very, very intensive campaign are 50% reduction in diarrhea and ARI. So this seems consistent with that, because those were ITT, right? So these are TOT for a less intensive campaign. 80% doesn't sound crazy. I mean, it's huge, but it doesn't sound crazy relative to that number. Yeah. Sorry, is that not what you meant?
No, yeah, that's what I meant.
Okay, cool.
It's too much.
Yeah. Mm-hmm.
Did you do any follow-up on you said you provided this specialized foam soap up to a year, but then after that point, did you do any follow-up to see if these households continue to purchase that specialized soap? Because even if it's not a resource constraint, it is one sort of additional thing, or if there's a transition to bar soap. Just curious to know what happened after you stopped providing that resource.
Yeah, I think those are very fair questions, and we're still in the midst of providing it. So we'll stop providing in December, and then we will do that follow-up. The nice thing is that this foaming soap is just dishwasher liquid that's diluted, which is very easily available and very cheap in these areas. So it seems to be a sustainable purchase. Yep.
I'm a little confused. What do you think is the source of the adjacent complementarity for hand washing? Like, why does washing today increase your marginal utility to wash in the future? It's very obvious with cigarettes, but I just don't understand why that would be the case here.
No, I think that's a fair question too, and I think this test of habit formation, like it's an empirical question for a lot of these good habits, right? We don't know if they're truly habits, but when you think about engaging in a habit, you think the more I do it, the easier it will be for me to do it. You could think about that maybe in the process of learning. You learn how to do things in convenient ways. Maybe it's just about attention, you know, things become habitual, it just becomes easier to remember to engage. But if you're aware of that, and that's why I like that 57% of people who say, I don't have a habit. So they're articulating this as something that is habitual, that they just never developed. So it seems like they're, you know, intertemporal complementarities is just a large and complicated word for something that I think we very much internalize, which is the more we do of something that is simple and repetitive, the more likely we are to do it.
Isn't learning different than adjacent complementary?
So I think the mechanism is the same. I actually, in our model, we try to separate the two because I want to say that hand washing is not something you really have to learn, and we give people some time to learn to engage with the dispenser. But it depends on how you define learning, right? Like if you define learning as reducing the amount of attention you have to pay to something and still engaging, then that is what habit formation is. But if you define learning as learning new skills in the, you know, and adapting to the environment, then hopefully that's not something that you have to do in this scenario. But the mechanism is the same. The more you engage in it in the past, the more likely you are to perform it or do well in it currently. At least in the learning models that I've explored.
So you have this idea that we're testing rational addiction, I think.
Yeah.
Does it need sort of, like it seems like the rational addiction is about adjacent complementary and the individual recognizing that exists. And that's a little different than the learning.
But if I am aware of, so the process would be the same in learning, that if I'm aware that something in the future, you know, if I take a test in the future and I get $1 million for it, then I'm much more likely to engage in practicing today, the day after, and the day of taking my SATs over and over and over again so that I really do well in the future. So it'd be the same sort of mechanism that's operating, right? That the more I engage in it today, the more likely I am to benefit by engaging in the future. And so then the real argument is just, is this something that requires learning, or is it something that requires this other sort of attention mechanism that we think of as habit formation? Yeah.
It seems like it's good that you're leaving a lot of data on the table because your model has some within peak, right? The peaks of decay.
Yeah.
So you presumably can back out from that something about the production of that habit formation and also the beliefs about it, because you're basically, you should get, I don't know, any arrested now or immediately, if I'm in the future monitoring, you should get big spikes and you should be able to kind of learn about the decay, which is different than, frankly, that's what a lot of those super reduced form, you know, Tigers to Chicago type tests. Well, the betas go in the right direction, and clearly the models comply with it, but here you actually see the process.
Yeah.
And it seems like you can put more with it.
Yeah, yeah. I also hope, you know, another thing we do is we roll out giving dispensers and then the announcements of the future things kind of in a staggered way. So some people have a longer time to engage with the dispenser use before these announcements. And we can use that variation as well to kind of tease apart this learning as well. Am I out of time? All right. Okay, thank you.